Amethoprid belongs to a class of drugs called corticosteroids, anti-inflammatory agents. It is not known if amethoprid is safe and effective in children younger than 12 years of age. What are the possible side effects of amethoprid? Amethoprid may cause serious side effects including hives, difficulty breathing, swelling of your face, lips, tongue, or throat, blurred vision, tunnel vision, eye pain, seeing halos around lights, shortness of breath, swelling, rapid weight gain, severe depression, changes in personality, unusual thoughts or behavior, new or unusual pain in an arm or leg or in your back, severe pain in your upper stomach spreading to your back, nausea, vomiting, bloody or tarry stools, coughing up blood, vomit that looks like coffee grounds, seizure, leg cramps, constipation, irregular heartbeats, fluttering in your chest, increased thirst, increased urination, numbness or tingling, muscle weakness, and limp feeling. Get medical help right away if you have any of the symptoms listed above. The most common side effects of amethoprid include weight gain, especially in your face or your upper back and torso, slow wound healing, muscle pain or weakness, thinning skin, increased sweating, stomach discomfort, bloating, headache, and changes in your menstrual periods. Tell the doctor if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of amethoprid. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Amethoprid, methylprednisolone sodium succinate for injection, USP. Sterile powder contains methylprednisolone sodium succinate as the active ingredient. Methylprednisolone sodium succinate, USP, occurs as a white, or nearly white, odorless hygroscopic, amorphous solid. It is very soluble in water and in alcohol. It is insoluble in chloroform, and is very slightly soluble in acetone. The chemical name for methylprednisolone sodium succinate is Pregna 1,4-dene-3, 20-dion, 21-3-carboxy-1-oxopropoxy-11, 17-dihydroxy-6-methyl monosodium salt, 6A, 11SS, and the molecular weight is 496.53. The structural formula is represented below. Amethoprid, methylprednisolone sodium succinate, structural formula illustration. Methylprednisolone sodium succinate is so extremely soluble in water that it may be administered in a small volume of diluent, and is especially well suited for intravenous use in situations in which high blood levels of methylprednisolone are required rapidly. Amethoprid, methylprednisolone sodium succinate, is available in several strengths and packages for intravenous or intramuscular administration. 40 mg single-dose vial each ml, when mixed, contains methylprednisolone sodium succinate equivalent to 40 mg methylprednisolone, also 1.6 mg monobasic sodium phosphate anhydrous, 17.46 mg dibasic sodium phosphate anhydrous, 25 mg lactose anhydrous, 8.8 mg benzyl alcohol added as preservative. 125 mg single-dose vial each 2 ml, when mixed, contains methylprednisolone sodium succinate equivalent to 125 mg methylprednisolone, also 1.6 mg monobasic sodium phosphate anhydrous, 17.4 mg dibasic sodium phosphate anhydrous, 17.6 mg benzyl alcohol added as preservative. When necessary, the pH of each formula was adjusted with sodium hydroxide, so that the pH of the reconstituted solution is within the USP specified range of 7 to 8, and the tonicities are, for the 40 mg per ml solution, 0.50 osmolar, for the 125 mg per 2 ml, 0.40 osmolar, isotonic saline equals 0.28 osmolar. Important, use only bacteriostatic water for injection, with benzyl alcohol, when reconstituting amethoprid, methylprednisolone sodium succinate. Use within 48 hours after mixing. When oral therapy is not feasible, and the strength, dosage form, and route of administration of the drug reasonably lend the preparation to the treatment of the condition, amethoprid, methylprednisolone sodium succinate, sterile powder is indicated for intravenous or intramuscular use in the following conditions. Endocrine disorders. Primary or secondary adrenocortical insufficiency, hydrocortisone or cortisone is the drug of choice. Synthetic analogues may be used in conjunction with mineralocorticoids where applicable. In infancy, mineralocorticoid supplementation is of particular importance. Acute adrenocortical insufficiency, hydrocortisone or cortisone is the drug of choice. Mineralocorticoid supplementation may be necessary, particularly when synthetic analogues are used. Preoperatively and in the event of serious trauma or illness, in patients with known adrenal insufficiency, or when adrenocortical reserve is doubtful. Shock unresponsive to conventional therapy if adrenocortical insufficiency exists or is suspected. Congenital adrenal hyperplasia. Hypocalcemia associated with cancer. Non-suppurative thyroiditis. Rheumatic disorders. As adjunctive therapy for short-term administration, to tide the patient over an acute episode or exacerbation in post-traumatic osteoarthritis, synovitis of osteoarthritis, rheumatoid arthritis, including juvenile rheumatoid arthritis. Selected cases may require low-dose maintenance therapy. Acute and subacute bursitis, epicondylitis, acute nonspecific tenosynovitis, acute gouty arthritis, psoriatic arthritis, ankylosing spondylitis, collagen diseases. During an exacerbation, or as maintenance therapy in selected cases of systemic lupus erythematosus, systemic dermatomyositis, polymyositis, acute rheumatic carditis, dermatologic diseases, pemphigus, severe erythema multiforme, Stevens-Johnson syndrome, exfoliative dermatitis, bullous dermatitis herpetiformis, severe seborrheic dermatitis, severe psoriasis, mycosis fungoides, allergic states, control of severe or incapacitating allergic conditions intractable to adequate trials of conventional treatment in bronchial asthma, contact dermatitis, atopic dermatitis, serum sickness, seasonal or perennial allergic rhinitis, drug hypersensitivity reactions, urticarial transfusion reactions, acute non-infectious laryngeal edema. Epinephrine is the drug of first choice. Ophthalmic diseases. Severe acute and chronic allergic and inflammatory processes involving the eye, such as herpes zoster ophthalmicus, iritis, iridocyclitis, chorioretinitis, diffuse posterior uveitis and choroiditis, optic neuritis, sympathetic ophthalmia, anterior segment inflammation, allergic conjunctivitis, allergic corneal marginal ulcers, keratitis, gastrointestinal diseases. To tide the patient over a critical period of the disease in ulcerative colitis,